Welcome you all in the course Mechanical and Electrical Safety, MIS 024. I am Dr. Naqi Anwar from Terry School of Advanced Studies, New Delhi. Today under this course, we will be studying first aid for electrical industry. So let's begin with the first aid and overview. So let's start with what first aid is. First aid is the first and immediate assistance given to any person suffering from either a minor or serious illness or injury, with care provided to preserve life, prevent the condition from worsening, or to promote recovery. In general, we can say that the first aid is the first action against any injury during accident or illness to control the situation. First aid is the first help that makes difference between life and death. So first aid is the first assistance provided with the available supplies and materials before medical help actually arrives. In first aid, suitable interventions to sustain life are initiated and further damage is reduced until the person is taken to hospital. The objectives of the first aid are to save life, increase chances of recovery, prevent further damages, and help the victim to reach regular medical care quickly. First aid provider. Who the first aid providers are? First aid provider is an important and key link in preventing further injury and shifting the victim to a suitable medical institution. Some of the important attributes of a first aid provider are: he or she must be very calm, observant, tactful, and patient. She or he must be adept to handle the crowd and involving onlookers for help. She or he should be trained in first aid and capable of administering immediate treatment to the victims at the time of emergency. It is the responsibility of the first aid provider to reach the accident or the emergency spot quickly and administer first aid after assessing the situation and victim's condition. Look at first aid box. The purpose of first aid box is to provide basic supplies for first aid. First aid box can be effectively used in controlling bleeding, preventing and treating shock, and treating conditions of burns. The first aid box checklist includes location and position of the first aid box, clear identification of the first aid box, contents, and quality of the contents. In the absence of availability of certain required items in the first aid box, first aid provider should improvise available resources. Now, we are moving towards our actual discussion with this brief introduction towards the first aid in electrical industry. We come across the news of electrocution often. Electrocution is the word generally used in the case of death or severe injury due to electric shock or electric current passing through the body. Likewise, we are also aware of the cases of electric shock. The awareness of electrocution and electric shock prompt us to think about electric hazards. On further exploration, we came across other electrical hazards. These hazards include burns due to electric arc and electric blast. Severity of these hazards and resulting injury needs special attention. Administration of first aid measures of victim needs special care. Now, if you look, there are certain signages which explains different types of hazards in electrical industry. So, if we look at the danger and warning signs just shown above, it should immediately come to our mind that what message these signs are conveying. These signs are indicative of electrical hazards. We often come across the news of electrocution and electric shock. Thus, it is important and necessary to see electricity as a companion as well as deadly hazard. Whenever the term electrical hazard appears, electric shock first comes into our mind. But electric shock is one of the electrical hazards. Other electrical hazards include arc and blast. Let us explore electric shock, electric arc, and blast so as to understand the injuries and burns caused by these hazards and corresponding first aids that would be required to be administered. So let's begin with electric shock. An electric shock is a dangerous and painful physiological effect caused by passing of electric current through the body of a human. Physical contact with energized electrical wire or devices is the main common cause of an electric shock. In case of exposure to high voltages such as on a power transmission tower, physical contact with energized wiring or objects may not be the necessary thing to cause electric shock. In such cases, voltage may be sufficiently high to create a flashover called jump in the air gap between the electrical device and the victim. Severity of electric shock depends upon many factors such as path of current flow, the duration of current flow, the magnitude of current, resistance of human body, the frequency of the current, that is whether it is AC or DC, and the voltage magnitude causing the shock. Now let us have a look at these factors. Duration of current flow. The amount of energy delivered to the body is directly proportional to the duration of current flow, as evident from the relation of energy given by E is equal to I square RT, where E is the energy in joules, I is the current flowing through the body in amperes, R is the resistance in the body in ohms, and T is the duration of current flow in seconds. Now let's see about the magnitude of current flow. Current less than 1 milliampere causes no sensation. Current between 1 milliampere and 8 milliampere causes sensation of shock but is not painful. Around 10 milliampere current is capable of producing painful to severe shock. Current around 30 milliampere can cause respiratory paralysis. The heart can fibrillate, that is quivering of the heart, by current of around 75 milliampere. This current can be found using Ohm's law, that is I is equal to V upon R, where V is the voltage and R is the body resistance. That includes skin resistance, internal body resistance, and resistance of the shoe worn by the person. Body resistance. The National Institute for Occupational Safety and Health, NIOSH, states in dry condition the human body resistance offered may be as high as 1 lakh ohms, that is 1 mega ohms. Wet or broken skin may drop the body's resistance to thousands ohm. Adding that, high voltage electrical energy quickly breaks down human skin, reducing the human body's resistance to 500 ohms. Fourth factor is frequency of current. The let go, that is release threshold in DC current, is higher than AC current. Voltage. At above 400 volt, the electric voltage may be sufficient to puncture the epidermis, outer layer of the skin. As the epidermis provides the major part of the resistance of the human body, the current magnitude will increase sufficiently and lethally when this puncture occurs. Now let's see about the electric arc. An electric arc is defined as a discharge of electricity through a gas, normally characterized by a voltage drop in the immediate vicinity of cathode approximately equal to the ionization potential of the gas. Electric arc are extremely hot. The heat energy of an electric arc can kill and injure personnel at surprisingly large distance. Arc burns are thermal in nature and fall into 4 categories. They are first degree, that is burning causes painful trauma to epidermis, outer layer of the skin. Second degree burns cause damage to epidermis and dermis layers are more painful. Third degree burns destroys epidermis and the dermis, which is beneath the epidermis. Fourth degree burns cause severe damage to all the 3 layers of skin within the human body. Now we will look at the first aid, that is what are the steps to be taken to apply the first aid for electrical industries. Following steps are to be followed in life-threatening emergencies. The first, a quick response needed. Second, situation must be assessed to ascertain whether circuit is still energized, that is live, or the victim is still in contact of the circuit. Third, action plan needs to be made as per assessed situation. Fourth, victim's condition must be assessed for administering first aid. If the victim is responsive, no action may be required. If the victim is unresponsive, the ABC of first aid should be administered. This ABC of first aid will be discussed in the latter part of this lecture. De-energized accident scenes should be ensured. Sixth step is required. First aid for electric shock and electric burns should be administered. Now what are the aims of first aid? First aid is an emergency process, generally includes simple life-saving procedure that most people can train to perform with minimum equipments and no past medical exposure. The main aims of the first aid are: first, to prevent life, that is, saving lives is the main goal of first aid. Second aim is to prevent further harm, means the person who has injured must be kept stable and their condition must not deteriorate before medical services arrive. This may include moving the patient away from the harm, applying first aid technique including CPR, that is cardiopulmonary resuscitation, keeping them warm and dry, and applying pressure to wounds to stop and bleeding. Third aim is to promote recovery, that is, taking steps to promote recovery may include applying a bandage to a wound. Now, as discussed earlier, we will briefly discuss the ABC of first aid. ABC is a memory device for first aid provider to remember the proper procedure when examining an unresponsive victim. Mnemonic: ABC stands for airway, breathing, and circulation. So details of mnemonic ABC are as follows. A, that is airway. Check the victim's airway. The correct way to clear an injured person's airway is head tilt and chin lift maneuver. Breathing. There are few obvious signs that indicate if the victim is breathing. The most obvious sign is the rise and fall of chest as the victim takes oxygen into his lungs. Further, breathe can be checked by placing one's mouth near victim's nose and mouth and feeling for any breath. Breathing can be counted for 15 seconds and may be multiplied by 4 to get per minute breath. C stands for circulation. Check the victim's circulation. Circulation should be checked by feeling for the victim's pulse at carotid artery. A victim's pulse may be checked by placing first 2 fingers into indentation to the side of windpipe. In case victim has no breathing and no pulse, perform CPR until pulse is restored. In case victim is breathing normal but has no pulse, then also perform CPR. Victim has no breathing but normal pulse, perform mouth-to-mouth resuscitation until breathing is restored. So now we are going to discuss the cardiopulmonary resuscitation process, that is CPR process, in detail. Always remember, before physically approaching the victim, the scene must be de-energized. So this is the step-by-step CPR guide, that first we should shout near the ear of the victim. If the victim is unresponsive, we should inform the SOS. Then we should check for breathing. Then place our hands at the center of the chest of the victim. Push hard and front about twice per second. You are getting nothing. Repeat this cycle for 30 chest pulses and 2 rescue breaths. So cardiopulmonary resuscitation, CPR, is an emergency procedure that includes chest compression with artificial ventilation in an effort to manually preserve intact brain function until further actions are taken to restore spontaneous blood circulation and breathing in a person who has a heart attack due to any reason. If the victim is not breathing, the first aid provider will need to do CPR. Its main purpose is to establish the flow of oxygenated blood to the brain and heart, preventing or at least delaying tissue death. CPR can extend the brief window of time during which successful resuscitation can take place without permanent brain damage. In 2005, the International Liaison Committee on Resuscitation agreed on new guidelines. These new guidelines stated that rescuers should progress straight to CPR if there is no breathing, instead of checking for a pulse. They also added that rescue breathing must not be performed without chest compression. There are 2 main steps in CPR: applying chest compression and then providing breaths. Now these 2 steps needs to be discussed explicitly. Apply 30 chest compression is the first step. In CPR, the first aider should kneel next to the victim and follow these steps. For adults, place the heel of one hand in the middle of the chest, place your other hand on top of the first hand and interlace the fingers as shown in the above figure have just seen. Push the chest down about 1.5 to 2 inches. If the person is a child aged between 1 and 8 years, compress to a maximum of 1.5 inch with one hand. Let go and wait for the chest to come back up completely before repeating. Your elbows must remain straight throughout. Push the breadstone up and down to a depth of about 5 cm about 30 times at a pulse rate of 100 beats per minute. Now, if we look at providing two breaths, the steps are: first, make sure the airway is open and pinch the nose so it closes. Second, gently raise the chin upward with two fingers of your hand. Third, take a deep breath. Seal your mouth over victim and exhale into the airway. Fourth, you should see the chest rise and fall. Fifth, to get another breath, lift your head and breathe in deeply. Perform steps 1, 2, 3 and 4 above again. Repeat the 30 chest compression followed by the 2 breath about 5 times and then check for normal breathing. If they are not breathing normally, continue performing CPR. If breathing restarts as normal, stay with the injured person until the real help arrives. Now we will look at the first aid for electric and burns. So let's quickly jump to the topic. Following first aid procedures should be adopted for electric shock as well as electric burn victims. So first aid procedures for conscious electric shock and burn victims. The procedure will be different for conscious and unconscious victims. So let's first discuss about the first aid procedures for conscious electric shock or burn victims. First, keep the victim still and quiet. Heart and respiratory problems can be delayed in electric shock victims. So monitor the victim's condition for at least 1 hour. First aid procedures for unconscious electric shock and burn victims. Check the ABCs. If the victim is not breathing or has heart irregularities, perform resuscitation. Then, if wounds are visible, cover them with sterile dressing. Then, if external burns are visible, they should be cooled using pure water. Fourth, immediately seek medical help. So with this, we are at the end of this lecture. Thank you.